Any condition really can cause carpal tunnel, but it's mainly those that cause swelling in the carpal tunnel itself. Things like diabetes, pregnancy, arthritis, injuries, mainly to the hand, and thyroid disease. Most people with carpal tunnel complain of numbness and tingling, so pins and needles in the distribution of your thumb, index, middle, and half the ring finger. They also complain of their hand being clumsy, they drop things regularly. They sometimes have pain around the palm as well, going into the thumb. On the signs, and when you examine someone, depending how long they've had the condition, they might have thinness or wasting of the muscle here, and as a reduced sensation in the thumb, index, middle, and half the ring finger compared to the other side. Certain positions you put the hand in, so if you tap around here, you get tingling. If you bend the wrist, failing sense again, it makes the symptoms worse. And also, if you compress and bend, again, that can make things worse. And often people also complain of night pain. Their symptoms get worse definitely at night. Yes, it can, if the condition that could cause it gets treated. So most pregnant women find their symptoms get better after they've had their baby. Rheumatoid arthritis patients and thyroid patients sometimes have improvement in symptoms when you treat the disease. The surgery itself is performed under local anaesthetic. So what I normally do is inject local anaesthetic into the palm around here. It's like a nasty bee sting when it happens. Then it depends on the patient. I sometimes put a tourniquet, which is a blood pressure cuff, up at the top of the arm. I don't always inflate it, but if we do, again, that's on for about 10 minutes. Then what we do, clean the hand, wash the hand myself, and then we make a cut about 4 or 5 centimeters in the palm, in line with the ring finger web space. We go down, we divide the ligament that's causing the compression of the nerve, free the nerve up, buzz any vessels, and then stitch it all up and put a nice dressing on top. So in essence, it doesn't take very long, about 10 minutes, 10, 15 minutes. Very good normally in regard to the dressing gets reduced at 48 hours. They have a little dressing underneath. The stitches are removed at from about 10 days to 14 days, depending on the patient and whether they smoke or they're diabetic or not. And then when the stitches come out, they massage the scar to flatten it out. People find that the night pain goes straight away from doing the operation. Any altered sensation to the fingertips is variable and really depends on how long you've had the condition for. If you've had it quite acutely, most people that I've talked to, most of my patients, get improvement in the tips of the fingers. If you've had it for a long time, there's no guarantee that will make any difference. The aim of the operation is to stop it getting worse.